Wound care is identifying why the wound is present, treating the reason why it is present, and also addressing any issues that might be making it worse or making it not heal. What fascinates me about wound care is that it is probably one of the most comprehensive pieces of medicine. There's a thrill once you finally get there, once you finally get to the reason, the treatment, the resolution.
We see mostly chronic wounds, so patients come in with a lot of emotions. A chronic wound really impacts a person's quality of life. At this point, they've usually tried things to heal their wound and it hasn't been successful, so usually very frustrated, overwhelmed, because it means they have a chronic wound.
Wound care is important because there are so many people that have wounds. I never realized that there were so many people out there suffering from wounds. A lot of people didn't even know that the wound care even had services, so they were trying to treat their wounds at home, and that was failing.
A typical visit for a patient, they come into one of our clinic rooms. The nurse will take their vital signs, take their dressing off, they'll clean the wound, measure the wound, just assess how it's doing, how the patient is doing, any questions that they have, if they need supplies, things like that. Sometimes they have to see other specialists like infectious disease or vascular, so just coordinating care, seeing where they're at with those appointments. And then one of the providers comes in, either myself or Dr. McSweeney or Dr. Salwich. We assess the wound, we debride the wound, and then we discuss what our next steps might be, dressing changes, things like that.
At the first visit, we try to perform a thorough evaluation, comprehensive evaluation. So that's identifying comorbidities that could be contributing to the reason why the wound presented or why the wound is not healing at that stage. We try to identify any of the other factors that could be weighing into that, such as poor circulation or poor nutrition, and address those things or get the appropriate testing to address those things from day one. The script that I use for my patients is red hot, swollen, white milky drainage. We want to know about that right away. If any of those things are happening, call us right away. If you don't treat those types of wounds or any type of wound, the primary risks are going to be worsening, which can lead to infection or tissue loss.
We try to provide as much education on what to expect to make it a little bit less overwhelming, and we try to always reassure patients that it seems like a lot right now, but it's going to help you so much in the long run in preventing wounds, keeping you healed.
Some patients will come in and they think we just have the easy fix and that the wounds are going to heal immediately. And sometimes that is the case. So if they have pressure ulcers on the bottom of their feet, sometimes it's just removing that pressure and the wounds will heal right up. But majority of our patients have what we call like arterial or venous ulcers. So meaning that the blood flow is compromised to that area. So normally we'll get some tests done, ABIs and venous studies, which will show the blood flow in the arteries and the veins. And if they have compromised blood flow, we will send them to a specialty doctor that will usually do some revascularization to that area to open up the blood flow, and that will help the wounds heal a lot faster.
One thing I love about wound care is we see our patients weekly, so we really do form a relationship with them and their family members. So we really get to know them on a more personal level, know what's important to them, what their challenges are. So with that, I feel comes just more compassionate care. We individualize a patient's care based off of the kind of wound that they have. Certain things work better for different kinds of wounds. We get to know the patient, we see them weekly, we try to bridge that gap so that they have the best outcomes. We want to know if there's any changes to the wound throughout the week, if there's any problems with supplies, anything like that. But ultimately it comes down to the patient, their willingness to commit to the process to heal.
Small improvements can be drinking less caffeine. If you are a smoker, trying to decrease the amount of cigarettes you smoke a day if you can't stop. Drinking more water, taking that multivitamin.
Ultimately, success looks like we heal a wound and then we never see the patient again. But a lot of times patients have chronic wounds or chronic areas of ulceration. They get wounds frequently in the same spots. So we like to try to address what's causing those wounds, fix that issue, so then the patient doesn't get a new wound, have to come back to see us.
It's so exciting when we can see the progression of the wounds getting smaller and even heal them, of like how exciting that they are, that they have accomplished something that they thought they were going to have forever.
To someone that was delaying care, I would tell them the faster that you seek intervention, the faster your wound will heal. There are, again, a lot of different reasons why a patient can have a wound. So we see all of that. And just because a patient has a wound does not mean that they've failed in their own care in any way. We're just here to advocate and provide the information that they need in order for that wound to heal. It helps a patient a lot to understand why their wound formed and how they can prevent it. And then our hope is that with the appropriate education and the appropriate treatment plan, that they don't get wounds again.
To see us at the wound care clinic, you can get a referral from your primary care provider, but we are actually self-referral. So you can call the number at any time and get established with us.
So if you or anyone you know has a wound, come see us at the Scheurer Wound Clinic.
I'm Jane Ballard.
I am Brenna Rakowski.
I'm Dr. Natalia Salowich, and I am Scheurer.